name's Megan. I'm a nurse practitioner student with Henderson State University. Do you mind if I do a cardiovascular assessment on you today?
Sure.
Okay. At this point, I would do hand hygiene and don clean gloves. Do you mind telling me your name and date of birth?
Kristen Sheffield, September 17th, 1991.
Okay, perfect. The first thing I notice about this patient is just her general appearance. She's very well groomed. She looks overall healthy. No visible abnormalities. So the first thing I'm going to do is I'm going to palpate I'm going to inspect your neck. I'm going to be looking for jugular vein distension. If you can move your head to the left and right. Okay, and if you'll stop right there, look to the left. I'm going to just look at where her jugular vein is and just make sure there's no pulsations and it's not distended. Next, I'm going to palpate her, you can look forward now. I'm going to palpate her carotid arteries, doing one side at a time. And both carotid arteries are going to be +2 in regular rate and rhythm. The next thing I'm going to do is I'm going to go ahead and since I'm up like in her neck area, I'm going to listen to her carotids and I'm going to be listening to any like bruits. And there was no thrills when I felt. So with this one, I'm going to use the bell of my stethoscope. And then I'm going to have the patient, when I start listening, I'm going to have her hold her breath so that none of the sounds through the trachea are mistaken for bruits. So if you will, when I start listening, if you'll just hold your breath. You can breathe now. No bruits were noted. The next thing I'm going to do is I'm going to go ahead and I'm going to palpate her brachial arteries. And I'm going to do this at the same time. And those are both +2 and they're equal bilaterally, regular rate and rhythm. Next I'm going to check her radial arteries, radial pulses. And those are both +2 equal bilaterally, regular rate and rhythm. I'll also check her popliteal pulses, and I'm going to do these at the same time as well. And those are +2 equal bilaterally, regular rate and rhythm. In this step, I would also check the patient's pedal pulses at the same time. And those are +2 regular rate and rhythm, equal bilateral. I'm also going to check my patient's hands. I'm going to have her hold her hands out and flip them over, and I'm going to check her cap refill. And at this point, I'd also check for any cyanosis. And if you will put your fingers together like this, and this is just checking for clubbing in her fingernails. Okay, you can stop. And the next thing I'm gonna do is I'm gonna have you scoot back and I'm going to assess your chest and I'm also going to listen to you. So the first thing we're gonna do is I'm going to, in a normal exam, I'd have the patient take off her shirt or put on a gown in the clinic or in the office. For video purposes, my patient is going to remain clothed. So I'm gonna have her lean back and then I would assess at her fifth intercostal space on the left side. I would just inspect that her PMI, there's no pulsations in her abdomen and no other abnormalities. And then I can also, while I'm assessing this area, I would feel for a pulse in her PMI, which is gonna be in that, like I said, the fifth intercostal space on the left side, and it's gonna be under that bra line. So you may have to have your patient raise the boob if they're like laying back. Next thing I'm gonna palpate her aortic pulse. It's gonna be the second, so I'm gonna feel for the second intercostal space. And it's a regular rate and rhythm. And I'm also gonna, and that's on the right side of her sternum. Then I'm going to do the pulmonic, and it's gonna be that second intercostal space as well, but on the left side of the sternum. And that's regular rate and rhythm as well. Next thing I'm going to do is I'm going to go ahead and listen to her. I'm going to listen to all her valves and her aortic, her pulmonic, her tricuspid, and her mitral valve. And this one I'm just going to do with the regular side of my stethoscope. Again, that's the second intercostal space on that right side of that sternum. And in a normal clinic setting, I would have my patient, I wouldn't be listening to her through her shirt. And then we're going to do the pulmonic, which is the second intercostal space on that left side. And then the tricuspid, which is going to be the third intercostal space on the left side, the sternum. And then we're going to listen. I would have the patient probably lay back a little bit more. And we're going to listen to her mitral valve, which is going to be on that fifth intercostal space on the mid-clavicular line. So through this assessment and listening to all her valves, there was no murmurs noted and no abnormalities with any of her rate, rhythm, anything like that. So thank you for letting me do my assessment today. That's it.